Buenas and Hafa. The Committee on Health and Veterans Affairs is now called to order. The time is 8 o'clock. It is Wednesday, April 8th, 2026. Thank you to everyone joining us this morning, both in person and online. Today we will be conducting a public hearing on the following measures: Bill 290-38 COR, introduced by myself and co-sponsored by Senators Sean Gumatautau, Speaker Frank Blas Jr., Senator Tina Rose Munoz-Barnes, Senator Jess Lujan, and Vice Speaker Tony Atta. This measure relates to the outsourcing of dietary services for the Guam Memorial Hospital Authority. Bill number 295-38 COR, introduced by myself, relative to establishing licensure for school psychologists and including school psychology within the healing arts and allied health professions. Notice of today's hearing was provided to all senators, stakeholders, and members of the media in compliance with the open government law. The notice was also posted on the Guam Legislature's website and the public notice portal. All materials have been uploaded to the committee drive and are available in print upon request. This hearing is also being recorded and will be available on the Guam Legislature's YouTube channel. At this time, I would like to recognize members of the committee who are present. Senator Sean Gumatautau. And we will go ahead and start today's public hearing on Bill 290. This measure was introduced at the request of the Guam Memorial Hospital as part of its ongoing efforts to operate more efficiently, reduce costs, and focus resources on patient care. Currently, Guam law places unnecessary restrictions on how GMH can manage its dietary services. These outdated limitations prevent the hospital from fully exploring more cost-effective and efficient options. This bill removes that barrier. It simply gives GMH the flexibility to evaluate whether food and nutrition services should be provided in-house, outsourced, or through a hybrid approach based on what is most effective and in the best interest of the hospital and the patients it serves. This is not about reducing quality, it is about modernizing operations, improving efficiency, and allowing hospital leadership to make responsible, data-driven decisions. At the end of the day, this is a common sense update that supports GMH's efforts to stabilize its operations while keeping patient care at the center. At this time, I'd like to invite those who are here to testify to please have a seat at the table before us. And if everybody could please introduce themselves and the capacity in which you are testifying today. We will start with Dr. Hagen.
Hafa. Good morning. Senator Sabrina Salas Matanane, Oversight Chair for Healthcare, Senator Gumatautau, and Senator Telo-Taitagui. I am Jolene Uggan, Interim CEO for Guam Memorial Hospital.
Hafa Senators, good morning everyone. My name is Bel Rada. I'm the Assistant Administrator of Professional Support. Good morning.
Hafa and good morning everyone. My name is Rada Lynn Gerardo, Assistant Administrator of Operations.
Good morning, Senators. Jesse Kenga, the Acting Associate Hospital Administrator for Operations.
Good morning, Yuka Hechanova, Chief Financial Officer.
Good morning, Carlos Pangilinan, Assistant CFO.
You can begin with your testimony on the bill.
Thank you. Dear Senator Matanane, thank you for the opportunity to provide testimony in support of Bill number 290-38, which allows GMHA to outsource dietary services. This legislation provides GMHA an option that can bring meaningful benefits and opportunities for cost savings, operational efficiencies, and improved food quality without compromising quality or accountability. Outsourcing dietary services allows GMHA to focus on its core mission to deliver quality health care by reducing the administrative, financial, and operational burden of running food services. Food service operations are resource intensive and cost GMHA $4 million to $5 million a year for personnel, supplies, and equipment repair and maintenance. The current calculated cost per meal served has nearly doubled, going from $14.12 in 2015 to $26.97 in 2025. This is due to increase in the general pay plan and the high cost of supplies such as meat and vegetables. Qualified vendors can leverage bulk purchasing and operational efficiencies, helping to reduce expenses and redirect funds to critical medical services. Vendors can also provide enhanced menu options to improve patient, visitor, and employee experiences. For FY 2027, we anticipate an overall savings of $1.4 million in dietary services outsourcing. This cost savings is contingent upon the successful procurement of such services and negotiations with an awarded vendor. Importantly, this bill does not require outsourcing. It simply provides flexibility, and GMHA can evaluate what works best for its patients, workforce, and operational needs. Further, this legislation is not about replacing people. It's about strengthening systems. With proper implementation, outsourcing can provide opportunities to current staff or pathways for continued employment under new management, as well as retraining, upskilling, and promotional growth. Susan Masi.
Anyone else going to be testifying from GMH on this bill? No? Okay. No? Okay. We will now open it up for questions. Senator Gumatata?
Yes, thank you, Madam Chair, and good morning to you, and good morning to the GMHA family that are with us today. And let me just start by saying it's only been a couple of days since the oversight hearing, so it's good to see you all again on this side of the island. So thank you for joining us this morning. For the benefit of our community who are following the discussion on this bill, what portion of GMHA's projected income of $133.6 million in FY 2026 represents revenue that was generated specifically by the hospital's dietary and cafeteria services?
The annual revenue from dietary services is about $400,000 a year.
All right, thank you so much, Yuka. I'm just going to add a bit of a personal story. I watched my late aunt at GMH when she was there. Whether she ate her meal or pushed it away, told our family everything about how her recovery was going. Can you speak to how patient food satisfaction and intake would be monitored under an outsourced type of model?
Good morning, Senators. So the way we do it, we have the guest relations who speak with the patients also, and we have clinical dietitian, registered dietitians who follow the patients, whether they finish all the food, their weight gain or weight loss. So in this instance, we would like to keep the clinical nutrition so that they can still follow whatever is being done right now, because these registered dietitians are the one who followed all the patients nutrition-wise, if they're malnourished, from the start of admission to discharge.
All right, thank you. Our people on Guam have specific cultural food preferences. What assurance can you give the committee that a contracted vendor would perhaps honor that?
So that would be part of our scope of services that we require. We can include cultural foods.
All right, thank you so much for that. Also, what information is available to confirm whether any performance-based review has been conducted by the authority's current or past leadership of the organization's dietary and cafeteria services, recognizing that although, and I know you mentioned a bit earlier, we're not talking about the staffing or impacts to it, although the staffing level for these services averaged around 50 positions during FY 2025 and FY 2026, the hospital requires $1.5 million for dietary food service supplies, or $250,000 less than its FY 2025 budget of $1.7 million, according to your budget request in 2026.
I'm sorry, could you repeat that?
Yeah, have you guys reviewed the performance when you're giving money for specific service? Are you even looking at whether it's in fact delivering as it's supposed to?
Yes, we have the patient experience surveys that are given to the patients, and they do provide feedback on a variety of things, including the quality of the food.
Right, and so if the survey, I mean, can you, for the committee, can you tell us what percentage actually do the survey? I know that people are on there, they want to go home, they don't want to be there any minute longer than they have to be. Obviously, just the stress of being in a medical facility, but is it a pretty high percentage, low percentage of people that actually do that survey? Especially when we think about the food part of it all, or dietary part of it all. If you don't have it, that's okay, but I'm hoping that you can at least get it back to the committee as we are before we do the markup of the bill. Is that okay? That's fair? Okay, no problem. And let me just go to my last question, Madam Chair. Acknowledging that the trustees has mandated hospital management to submit a detailed reduction in force implementation plan, what information is publicly available on the extent to which the outsourcing of non-patient dietary and cafeteria services has been considered since the adoption of resolution number 2026-08 on October 29, 2025?
Senator, to speak to the communications with the employees, what legal had found and discovered working with the committee is that there's a restriction on the outsourcing of all dietary services at the hospital. So the discussions were halted until such time we could find there's a legislative appetite to change that policy, so we know exactly how we formulate the rules.
Yes, and thank you for sharing that important aspect to the committee. Madam Chair, that's all the questions I have. Thank you, GMH, for being with us this morning. I appreciate your time.
Thank you, Senator Gumatata. Could you provide us how many employees currently work in the cafeteria?
Right now, Senator, we have about 38 in the cafeteria itself. 7 of which are in SNU, and that doesn't include the, and it includes the food and beverage manager and the chef supervisor. Those are just in the cafeteria. It doesn't include the registered dietitians, the dietary technicians. It doesn't include that.
How many meals do you guys prepare on average a day?
On average, we have breakfast, lunch, and dinner. So I can speak about monthly. We prepare about, if I remember correctly, about more than that, 347, if not more, per month, because that's for breakfast, lunch, and dinner for all the patients.
We have data from our cost reports that tell us how many meals have actually been distributed on an annual basis. For fiscal year 2025, it was about 196,266. In 2020, it was 191,265. And in 2015, it was actually a bit higher at 218,897. So as you can see, there actually has been somewhat of an adjustment or a decline over the years, over the last 10 years, but the cost of the dietary services has gradually been going up. So we need to figure out ways to align patient demand with the actual operational cost of the dietary services.
What about for the public? Because you can go there, right, and just go get lunch if you want over at the GMH cafeteria. Or do these numbers incorporate meals that are
No,
purchased?
these meals are purely for patient services. The cafeteria itself is kind of, at least in terms of how CMS looks at our costs, it's really more of a sort of like an employee benefit in a way, if you wanted to think about it. Whereas the bulk of the cost is really the food services that are distributed out to the patients.
Okay. And so just so I'm clear, so the revenue you generate from dietary services is $400,000 annually, but it costs anywhere between $4 to $5 million for personnel, supplies, and equipment.
Yeah, and overhead as well, not just the direct cost of the dietary services, but also maintenance of the facility, administrative, utilities, and etc.
And if this bill were to become law, you're looking at saving at least $1.4 million.
The preliminary projections show that, yes.
Okay, thank you. Senator Taitagui?
Sujusmasi, and good morning, colleagues, especially good morning to the Guam Memorial, hard-working Guam Memorial Hospital individuals. I know I want to thank you for that tour that you gave the senators the other day and see the progress from it, so I greatly appreciate it. It's nice to see you know, all the hard work on both sides that have been doing. We've been giving you the funding, and I'm just glad to see that it's working. But that being said, going further and deeper into the Guam Memorial Hospital on areas that you can correct, and this is one way that, or not correct, but just, you know, minimize the cost and be more efficient with your funding. I know you guys, you've tried very hard to find ways to, you know, give the same quality of service, not losing that, but finding a more cost-efficient way of doing so. Now, this bill, if it were to pass, it doesn't obligate you to do so. It just gives you the authority. Dr. Uggan, is that true? Just gives you the authority to do so, if you want to.
That is correct.
Will you still have to go to the board after you've, if the bill passes, would you still need to go to the board to get their approval, or can you just move forward without the board's approval?
The board has already concurred with this plan.
Okay, so and then they leave it up to the administration to move forward with that?
That is correct, Senator.
Okay, so we always worry about, you know, when we're contracting out services and we look at our employees that are currently there. Now, will there be negotiations with a vendor, or, you know, there's of course going to go through the procurement process. You're going to put the specifications in there. Would one of them be there to avail the company of using the current employees?
That's a great question, Senator. Yes, our RFPs include first right of refusal for our employees. Okay. And if you look at the cost for the employee, they're wage earners at approximately $12, maybe $14 an hour, but it's where the government benefits bring, I think, substantial increase to the cost on the government side. We can potentially see the vendor offer these employees a higher wage and more training opportunities. That's been our experience.
You know, as the oversight chair of retirement, you know, I look at our employees. Once upon a time, back in the 80s, being a government of Guam employee had so many great benefits to a point it could bankrupt our retirement, and that's why people wanted to go with the government of Guam. But it does have some security with that perspective. So what happens then of these employees if they decide to jump? You know, do they, I mean, we now have like 401ks and stuff like that. So how are you going to ask the vendor how they're going to abide with the retirement, or how are they going to fulfill the retirement benefits?
So it would be dependent on the selected offers, fringe benefit offering to those employees that are affected by the outsourcing. And ultimately, the government has a lot of latitude to include in the specifications what extent they, first right of refusal being one, compensation and other factors are evaluated when they submit the request to offer.
Okay, please keep that in mind when you're doing your RFP and you're soliciting to help these employees. The other question I had is there anything in there when, well, you know what's going on with Operation Epic Fury and everybody experiencing issues with providing services. Is there anything during the service of supplying, food to those at GMH, if there's a disruption or anything like that, is there going to be anything in the RFP to provide any kind of backup considering the situation that we're in right now? It's safety precautions, in other words, and incorporating that into a contract is, I think we need to do that now. I mean, we're looking at the world today, what's happening. We need to put something like that in there.
Absolutely, Senator, and we can share with the committee and yourself once we see a favorable policy decision for this bill and we begin to formulate the full RFP, we can share that with the committee so they can review what exactly the government is in search for.
And in the event, for some reason, your contractor, whoever you contract, pulls out at last minute, will you have a contingency plan in place? And I hope you do, because everybody needs that, backup plan A, plan B, plan C, scenario. So there's no question to that, just for a consideration. In the event they back up for some reason, that you have a contingency plan. Okay? Other than that, I'm sure that you've done everything you can possible to find ways to cut cost. So I just hope that it's not at the detriment of those hardworking individuals at Guam Memorial Hospital, that if you do, that they're placed in other areas to continue to provide, their families with the living. Okay, so other than that, thank you so much. And again, thank you for that tour. I greatly appreciate all the hard work that you did. Thank you.
Senator Terlai.
Thank you. Good morning, everyone. So just wanted to check on a couple of things. So I don't think we were provided the written testimony, but I wanted to find out if, so you said there's, you currently spend $4 million. How much of that is on personnel on this?
I can offer that, Yuka. So inclusive of the technicians, both salary and benefits amounts to $2,726,000. And then we can provide this also to the committee so you can have that for the report.
All right, so, and then you said you estimate that if you contract this out, you're going to have a $1.4 million savings. Do you have a cost analysis on that? Can we get that? We have nothing in front of us that shows.
Yes, we
how
can
you
provide the
calculated
cost
that.
analysis.
All right, so does that cost analysis of a $1.4 million savings include the vendor's going to pick up the $2.7 million in employees?
Yes.
All right, and you were saying that there was, that you're estimating they're going to get savings in bulk purchases. I don't know. I just remember when we did this, or not me, but when the senators did this for DOE and thought there was going to be cost savings. That's not what ended up happening. And the employees, I think, all preferred to have the government of Guam jobs and benefits. And I think even some of you came from the private sector. So I think that's still relevant today as to whether they want that. And I know one of the other things stated this morning was that this is not about getting rid of people, but I'm looking at the bill and the law that currently exists. So the law currently says that you can contract these services out. It says shall not, that if you do contract, shall not apply or pertain to replacing, supplanting, and/or eliminating GMH's in-house dietetic services department. And that's the part of the law that we want to have stricken by this bill. So to me, it's absolutely about that ability to get rid of employees as opposed to protecting them like this requires. So the bill, if it's passed the way it is, has no protection at all for those employees. And I know you're saying you have an RFP already made?
No, we don't. And Senator, to clarify, all employees, especially those that are merit recruited employees, will still have to go through any merit process for their potential reduction in force. And we would follow the personnel rules and regulations, so we ensure that we protect the merit class employees.
So that's the process that they're allowed. There's no special process in this that you're saying. I thought you were saying they're going to be picked up by these contractors.
It will be built into the RFP, Senator, that they be given the first right of refusal for any employment opportunity generated by the outsourcing of these services. For those employees that do not select to take the offer up, they're not automatically displaced, if that's the clarification you're seeking, because they're still merit employees and we have a process to undergo.
That they get offered in another agency, or they could if there's an opening, right? That's the process?
Or rather, Senator, if there are other areas of the hospital that their skill sets are needed, that they could be reassigned to those departments. Yes.
Yeah. So how many employees are we talking about?
We have 38 employees, Senator.
38. Can you tell us, Yuka, why, just tell us a little more about your analysis of why you think there's a $1.4 million savings.
The savings will consist of the reduction in the staff
Benefits.
and the benefits, and also a big portion of that is also the purchases of supplies, which is mainly in the dietary department. It's for the meats, vegetables, the ingredients that we use to prepare all the meals. We also have significant maintenance costs to maintain all of the aging equipment in the kitchen. That will also be reduced as well.
When they did an analysis when that Gita hired the GMH consultant, what did the GMH consultant say about reducing employees or dietary services? Does anyone know? I know you guys reviewed the reports and provided your feedback as well. Did they say that's the problem that GMH has, that they need to reduce dietary employees?
Not specifically, no.
What does anyone know what that consultant said about it? Could we get a copy of that so that we could also look at that compared to this I guess, proposal to improve the hospital versus what the GMH consultant said about improving the hospital?
And I think you answered the question, Senator. It is a GITA consultant and a GITA report. The hospital was asked if we would support the release of the report, and the Board of Trustees extended that support to GITA. We can definitely follow up on your behalf if they can share a copy of said report.
All right. So as far as you know, there's no recommendation, though, for what we're seeing today?
No, and to the best of our recollection, that report instead talked about the government of Guam merit system and how it had imposed some unfair practices of maintaining employees when there would be, in their eyes, a preferred method for displacing employees easily, which I think is opposite of what
Say that again? That we have, say that again?
Yes, the part of the report didn't offer dietary services. Instead, they discussed, to my best recollection, an addressing of our merit system, and they were hoping that the policymakers might entertain a new sense of unclassified status at the hospital in order for employees to easily be offloaded or dismissed at will by management.
All right. And when you said that there's a legal impediment, can you read that to us, what you were told about the legal impediment? Do you have a legal opinion or something?
We can refer back to the bill, Senator. The bill itself is a direct extraction of the citation of law.
The law
and the
currently
area in
allows contracting, right?
It does allow contracting for services except for inpatient dietary
Except
services.
that you can't get rid of the current in-house dietetic services department. That's what it did. It protected the employees, and that's the impediment.
And Senator, what we're hoping to achieve through the passage of this bill is to present a full analysis of what outsourcing can truly achieve. We're unable to deliver that if outsourcing is restricted to only outpatient services, which, as you can hear from earlier testimony, that presents such a small fraction of the total costs and expenses for the operation.
So there is no analysis yet, you're saying?
We have financial analysis that we did offer to share with the committee.
So you do have a financial analysis, even with this impediment to keep the employees, right? It's not an impediment. It was purposely put in there. But right now, GMH is allowed to contract, but just has not decided to do that, right?
The authorization to contract, Senator, was restricted only to outpatient dietetic services. The intent and purpose of the bill is to expand, to allow the hospital to consider outsourcing of all dietary services.
Well, it says it should not replace, supplant, or eliminate the in-house dietetic services department, those people, but it didn't say you couldn't contract that out, I don't think. That's why I want to see what you've been told, what's your legal analysis that you're working on, your cost-benefit analysis as well. If there's a savings and we're going to get equal quality, then of course it's a good idea, but I'm just saying in past experience, we haven't seen that, so I'd like to see
Senator,
that.
there's two issues here. One is, so the current law allows us to outsource the cafeteria, but it doesn't allow the vendor who is cooking in the cafeteria to also cook for the patients. So the cost savings would be that this vendor can do bulk purchasing for all the food that's prepared in the hospital, whether it's for the cafeteria or for the patients. That's where the cost savings is going to occur.
I understand that's what he's saying as well, but that's why I want to see your legal analysis, why you say that's not allowed, because I just want to see that, yeah. Because it's very clear that contracting's allowed, and then the only restriction is that you can't get rid of the in-house dietetic services people, yeah. All right, thank you, Madam Chair. Jesus Masi.
Thank you, Senator Taitigui. Is there anybody else that is here to testify on Bill 290? If not, thank you for attending today's public hearing. Also, thank you for the work and the changes that you're doing at the Guam Memorial Hospital. Bill 290 is fully heard by the Committee on Health and Veterans Affairs. We will now move on to Bill 295. Again, Bill 295 is a measure that was introduced to address the need for clear licensure standards for school psychologists. Currently, Guam lacks a formal licensure framework for these professionals, despite the critical role they play in supporting students' mental health, behavioral needs, and academic success. The bill establishes clear standards, aligns Guam with national best practices, and formally recognizes school psychology within the healing arts and allied health professions. Importantly, it also includes a grandfather provision to ensure current practitioners can continue serving without disruption. This is especially urgent as our schools face increasing demands for mental health services and early intervention. If we are serious about supporting our students, then we must ensure the professionals serving them are properly credentialed, supported, and held to consistent standards. This bill closes that gap. At this time, I'd like to invite, well, you're already here, so if you could introduce yourselves and let us know in what capacity you are testifying today, and please speak closely into the microphone. Thank you. We'll begin with you, Superintendent.
Buenas and half a day, honorable senators, Senator Sabrina Matanane, Senator Gumatauta, Senator Chavalahi, and Senator Taitigui. Buenas and half a day. I am Judith Wanpat, Acting Superintendent of the Guam Department of Education. I'm writing to express my strong support of Bill 295-38 that defines a school psychologist and establishes licensing requirements that meet national standards with a slight modification. I recommend that the qualifications for licensure section that references Praxis 2 in section 12A, 1202C be non-specific in order to allow for alternative examinations that measure competency and national standards rather than a specific test name. The grandfather provision is an essential element of the proposed legislation and provides relief from the quandary facing the 6 employees who are currently employed by GDOE as psychologists and licensed by the Guam Allied Health Board examiners as mental health professionals. Since the post-COVID pandemic, the department have seen a sharp increase in students experiencing cases of emotional dysregulation such as anxiety, depression, trauma responses, and behavioral needs across age and gender. School psychologists are the best equipped to address the intensive needs of Tier 3 students who require highly individualized, data-driven interventions. They bring specialized expertise in mental health, behavioral science, and educational assessment that directly bridges the gap for these students, enabling them to thrive academically, socially, and emotionally. School psychologists are skilled in conducting psychoeducational and behavioral assessments to identify maladaptive behavior, learning disabilities, attention deficit hyperactivity disorder, ADHD, and social emotional needs. To address attendance, discipline, and academic support needs, school psychologists design, monitor, and evaluate individualized Tier 3 interventions such as short-term therapy, crisis intervention, and suicide risk assessment. This also includes training faculty, staff, and families in behavior supports and trauma-informed practices essential to student success. The department has established a multi-tiered system of support framework that embeds the school psychologist to help close the achievement gaps in performance, reduce behavioral offenses, improve attendance and graduation rates, and create a more inclusive learning environment for all students. In closing, I want to thank Dr. Mamie Balahaja, the chairperson of the Guam Board of Allied Health Examiners, for her tremendous effort and response to the unique needs of the Guam Department of Education. I urge all senators to prioritize this legislation as an investment in student success. Establishing a school psychologist position is both a practical and evidence-based approach that will improve student safety, well-being, and academic success. On behalf of the department, I thank the 38th Guam Legislature for introducing Bill 295-38, Sidus Maasi, for the continued partnership in education.
Thank you, Speaker Wampat. Dr. Balahaja, did you want to testify next?
Good morning. Good morning, Senator Matanane, Senator Gumatau, Senator Talahi, and Senator Taitigui. Thank you. Have a day, Senator Matanane and honorable members of the Committee on Health and Veteran Affairs. I'm Dr. Mamie Balhaja, a clinical psychologist for 41 years. I've been serving on the Guam Board of Allied Health Examiners for 23 years and elected chairperson for the last 16 years. Also, I have served on the Commission on the Healing Arts for the past 6 years and the chairperson-elect. Thank you for introducing the select bill to include the profession of school psychology for licensure under the auspices of the Guam Board of Allied Health Examiner. In Guam, school psychology should be an integral part of the general practice of health service psychology. Properly established school psychologists in the Government Guam professional classification system speak highly of employees currently providing psychological services in the school system. The subject bill would put in place that the profession of school psychologist is valued and necessary in the required service of our school system. I'm hopeful that the distinguished senators of the 38th Guam legislature will agree with me. Therefore, I urge that this bill be passed unanimously, which is set only to benefit the children and parents of Guam and this community. Thank you.
Thank you, Dr. Balhaja. Ms. Cepeda.
Good morning, distinguished Health Committee members, Senator Sabrina, Chair of this committee, Senator Shangu Mitauto, Senator Telo Taitigui, and Senator Therese Gerlachie. My name is Nadine T. Cepeda, the lead district school psychologist at the Guam Department of Education. I stand before you as a mental health provider with 25 years of experience serving children and families on Guam at the Department of Mental Health and Substance Use, now called the Guam Behavioral Health and Wellness Center, Client Services and Family Counseling at the Judiciary of Guam, and currently at the Guam Department of Education. I have watched children and adolescents carry heavy issues that no child should have to carry. I ask you to vote yes on this bill to establish a school psychologist because behind every attendance chart and test scores is a human being whose heart, fears, and hopes shape their ability to learn. I think of a sixth grader I knew when I first started at GDOE 10 years ago, who came to school with a clenched jaw and a backpack that was more than expected. She could do the math, but when a question was asked, her hands shook and she left the room. Without help for 3 years, she was labeled as disruptive or unmotivated. She was in high school and was often suspended for smoking and skipping. She was finally referred to me for assessment and recommendations. She learned simple breathing tools, practiced coping skills in a safe space, and felt seen. She loves numbers and is currently in college studying to be a math teacher. It took someone like me who is trained to provide assessments and therapeutic services to help students like her believe in themselves, stay regulated, and feel encouraged that all things are possible. I think of a kind, quiet student who, after several losses during COVID, stopped trusting adults. Teachers wanted to help out, but didn't know how to help him. I trained faculty and support staff on trauma-informed care and signs of trauma, which guided staff, consulted with me, and in return, the school team, including the district office, supported the family and held that the child through grief so he could keep learning instead of being left behind. Proudly, he is graduating this year as a top student in one of our high schools. He will be going off to college off island. These are not isolated stories. Anxiety, grief, trauma, substance misuse, depression, and overwhelm are showing up early and more intensely. Students with untreated emotional needs miss days, fall behind, act out, or withdrawn. Every lost learning day chips away at a child's future. Every missed opportunity to intervene increases the chance they will need far more intensive and more costly services later. Not every student is as lucky as I mentioned previously and had success stories, but rather students who are sexually assaulted, neglected, homeless, hungry, exposed to violence and substance use are often labeled as delinquents or frequently suspended. There are currently 6 psychologists at the Guam Department of Education serving over 23,000 students. Yes, that number is 23. The National Association of School Psychologists recommends a school psychologist to student ratio is 1 to 600. But the current ratio is 1 to 4,600. Universal screening was conducted in 8 pilot schools, including 4 middle and 4 high schools, and only 7th and 8th and 10th graders were screened. In school year 23-24, 216 students were oriented to the universal screening, and 57 were only screened using 57 were screened for the Columbia Suicide Severity Rating Scale. 1 student had active thoughts of suicide. 6 students were referred to Child Protective Services. In school year 24-25, 1,828 students were oriented, and only 264 were screened, with 31 students referred to CPS, 63 students screened for suicide ideation or attempts. In school year 25-26, 1,710 were oriented, with the same alarming numbers. 63 students were screened for suicide ideation and 31 CPS referrals. The data is alarming, and this is why I emphasize that the grandfather provision in this bill is critical to ensuring a consistent level of care for all students at GDOE. We need to build capacity to prevent suicide and other mental health and substance use issues so students can succeed and graduate. This bill is just not a definition of a school psychologist that includes rigorous education and intense training. It is a commitment that our schools will meet children where they are emotionally, not just academically. A school psychologist focuses on emotions while they build school-wide social-emotional learning, identify students who are struggling before crises occur, provide targeted interventions, coach teachers in trauma-informed practices, and respond when emergencies arise. The work keeps students in classrooms, reduces suspensions, strengthens families, and restores a sense of safety that makes learning possible. Investing now and voting on this bill saves money more than money. It restores childhood. It gives a scared child a trusted adult who knows how to listen and help. It gives teachers tools to reach students rather than burn out trying to do so. It gives families hope, and their families are seen and supported. Please pass this bill. Vote to establish a school psychologist so every child in our district has a chance to come to school feeling safe in their body and mind, ready to learn. Our children's futures depend on it. Thank you, and Tazuz Masi.
Thank you, Mr. Anderson.
Matanane Sijus, Chairwoman Senator Matanane, Senator Gumatauta, Senator Talai, and Senator Taitigui. Sijus Masi, for your continued partnership and support of the Guam Department of Education. I respectfully submit testimony in support of Bill 295-38 that provides for school psychology licensure and includes this new job in the healing arts and allied health professional definitions. The proposed amendments will greatly support the 6 psychologists who have been providing behavioral health supports ranging from 5 to 20 years for students and families at all DOE schools. The department has been recruiting and hiring psychologists using the Civil Service Commission job description adopted in 1980. For the past 46 years to date, psychologists have been helping students succeed by administering and interpreting psychometric evaluations used to assess cognitive, perceptual, academic, and affective domains. They have been instrumental in providing early intervention for at-risk students using targeted and intensive interventions under a multi-tiered system of supports framework for generations of Tier 2 and 3 students. These clinical services include, but are not limited to, small and large group counseling, screening, individual and family therapy, functional behavioral assessments, behavioral intervention plans, wraparound services, and crisis support for students with acute distress. Establishing a definition for school psychologists, qualifications for licensure, and a grandfather provision for current employees are all critical remedies for the 6 individuals hired by the department before subsection 121201F was passed into law in 2022. The current language restricts the use of psychology in a job title for those not meeting the qualifications for a clinical psychologist. The passage of Bill 295-38 will provide continuity of critical services provided by impacted DOE employees. One common malady that students exhibit across the district is emotional dysregulation. The underlying reasons are varied, but one important factor is exposure to trauma in early childhood. Untreated students can develop all sorts of harmful coping mechanisms that negatively impact their ability to succeed in school, such as substance abuse. A 2024 national youth survey conducted by the Substance Abuse and Mental Health Services Administration showed that drug use, alcohol, nicotine, and marijuana continue to be the most commonly used substances among Americans. 1 in 4, or 25% Americans 12 years or older reported illicit drug use in the past year. Based on 5 years of data from the Department's Student Information System, the average number of substance use, drug, and nicotine offenses adjudicated by school administrators was 380, males being 2 or 3 times more likely than females to use substances, drugs. The department has invested heavily in mental health supports by establishing a behavioral health services team comprised of psychologists and social workers under the Student Support Services Division. The behavioral health services team uses a multi-tiered system of support to address mental health issues. Tier 1 involves universal strategies and supports. Tier 2 offers targeted interventions, and Tier 3 provides intensive, individualized interventions for students with significant learning or behavioral challenges, often involving specialized personnel or programs. Behavioral health services consists of 3 areas of care: psychological services, school-based behavioral health, and enhancing your mental health. Psychological services include psych evaluations, providing mental health diagnoses, and creating treatment recommendations. School-based behavioral health is designed to provide students with therapeutic services that foster positive student connections with peers, family, school, and community. The Enhancing Your Mental Health state is a pilot program in 8 secondary schools designed to screen students in need of mental health and substance use services through the use of a universal screening tool. The goal is to identify Tier 2 and 3 students who may be experiencing mental health challenges and provide targeted support through case management and therapeutic counseling. One of the key highlights in the pilot program is the requirement to wait 45 days before screening students based on Public Law 31202. The attrition rate from orientation to screening to actual services provided is quite high. To address this issue, the department is currently working with Senator Borja to introduce changes to the law. The intent is to provide Enhancing Your Mental Health state services in all schools for 26-27, which is coming up very shortly. Guam's youth are faced with a myriad of challenges and life-altering decisions that can negatively impact their academic success and motivation to complete their education. School psychologists are an important resource for schools, establishing safe learning environments that empower students to make healthier choices that navigate them through potential storms. In closing, I want to recognize my 6 colleagues who work tirelessly each day to service the most at-risk and in need of support. Their impact on students and contribution to the overall success of the department is immeasurable. Also, special thanks to Dr. Mamie Balahaja, chairperson of the Guam Board of Allied Health and Examiners for her expertise and collaborative effort in proposing the opportunity for school psychologist licensure. And lastly, I want to thank Senator Sabrina Salas Matanane and the other members of the Committee on Health and Veterans Affairs for their forward thinking and responsiveness to the needs of the Department of Education and the Guam Board of Allied Health Examiners. When passed into law, Bill 295-38 will go far to help students succeed and become productive members of society. Again, Sizus Masi for your continued partnership in education.
Thank you, Mr. Anderson.
Hafiday. Good morning, Senators. Senator Gumatato, Matanane, Tulahe, and Tategwe. I'm writing to express my full and heartfelt support for proposed Bill 295-38. My name is Dr. Edward Santos. I hold a PhD in clinical psychology from Palo Alto University. After graduate school, I worked for several years in Denver. I was asked by my Santos family to serve the community on Guam. After the request, I made the decision to move to Guam, the homeland of my father. I'm currently a psychologist with the Guam Department of Education. Bill 295-38 seeks to establish and define the educational training requirements for school psychologists. This legislation is not only timely, it's deeply necessary. Every day, our students walk into classrooms carrying burdens that are often unseen: anxiety, grief, family instability, and overwhelming academic pressure. These challenges do not stay at the door. They follow the students into their learning, shaping their ability to focus, participate, and succeed. School psychologists stand at the intersection of education and mental health, offering a lifeline to students who might otherwise go unnoticed. Their role is both critical and compassionate. They encompass early identification of learning and behavioral needs, often catching struggles before they become crisis. Delivery of essential mental health interventions that help students regain stability and confidence. Crisis response during moments of profound loss and trauma, such as recent efforts for supporting schools after a loss of a student and a faculty member, and trainings on relevant issues in mental health. Collaboration with teachers, staff, and families to build environments where students feel safe, understood, and supported. Participating in initiatives like the Enhancing Your Mental Health State, which has already provided screening and intervention to vulnerable students across multiple schools. And lastly, serving as trusted adults for students who may never otherwise seek help, quietly changing the course of their lives. Despite the extraordinary impact, our schools remain critically underserved. Currently, just 6 school psychologists serve an entire student population of over 23,000, an overwhelming ratio of 1 to 4,600 students. This stands in stark contrast to the National Association of School Psychologists' recommended ratio of 1 to 600. Behind these numbers are real children waiting long for help, slipping through the cracks, or going without support altogether. Expanding the number of school psychologists is not simply an operational improvement, it is an investment in human potential. When students receive the mental health support they need, the transformation is undeniable. They show renewed engagement and improved academic performance. They attend school more consistently, feeling safer and more connected. They are less likely to face disciplinary action, and underlying issues are addressed with care. They gain the tools to cope, grow, and build resilience. Bill 295-38 also strengthens the proposed implementation of the multi-tiered system of supports, as known as MTSS, a proactive and comprehensive framework that ensures students receive the right level of care at the right time, from universal supports to intensive individualized interventions. By addressing challenges early, we reduce the need for more severe and costly interventions later. We must also recognize the long-term implications. Research has shown that academic failure is one of the strongest predictors for juvenile delinquency. When we support students academically and emotionally, we're not just improving the report cards, we are shaping futures, strengthening communities, and preventing hardship before it takes root. At its core, this bill is about care, dignity, and responsibility. It reflects a commitment to seeing every child not just as a student, but as a whole person deserving the support, understanding, and opportunity. By increasing access to school psychologists, we are sending a clear message. Our students matter. Their struggles matter. Their futures are worth investing in. I'm reminded of a student, a gifted athlete, a boxer who wanted to compete in the Golden Gloves. We shall call him Timber the Boxer. Timber the Boxer was failing in school due to learning challenges. This student was on the edge of dropping out. Due to his problems in school, he was struggling with negative self-esteem. He was starting to associate with peers that had already disassociated with the world of school. Unfortunately, the social bonds between himself and teachers were on the brink of being broken. He started engaging in delinquent acts of vandalism, petty theft, substance use, and assaults. Statistically, he was starting on the dark road of incarceration. Then, the unpredicted happened. Somehow, some way, his path led to the referral to the behavioral health team. The team brought in the people who had a stake in his life, his coach, the parents, a peer mentor, and his favorite teacher. He was provided intervention at the right place at the right time. Maybe it was a miracle, or maybe it was the souls of his ancestors who were guiding him. All I know, he was able to turn his life around. The team was able to support his learning with encouragement of important people, including his coach. He thrived and soon was able to apply to his academics the same passion as in boxing. Timber the Boxer went on to graduate from high school and enter the military. He strived with the discipline of the military and finished an active duty career. He continued his boxing in the military and went on to participate in national competitions. So rather than entering the judicial system, Timber the Boxer became a productive member of society who proudly served his country. I dare to say our justice system has many struggling students that would turn their lives around if just given the opportunity, as in the small miracle of Timber the Boxer. Therefore, I respectfully urge you to support this vital legislation. The need is urgent and profound. The cost of inaction is far too great. Our students deserve to be seen, heard, and supported, not just when they are struggling, but before they reach that point. Thank you for your time, your leadership, and your commitment to the well-being of our students and communities. In the words of Arthur Fletcher, who once said, "A mind is a terrible thing to waste, but a mind is also a wonderful thing to invest in." Thank you.
Thank you, Dr. Santos.
Hafide, buenas and Hafide, Chairwoman, Senator Matanane, Senator Gumatautau, Senator Teresa Lahi, and Senator Taitugui. Buenas, and thank you for having myself and my colleagues here to express our support for Bill 295-38. My name is Dr. Tony Cruz, and I am submitting this testimony in strong support for this bill. This bill establishes a clear road for future school psychology professionals within GDOE through implementing a school psychology licensure requirement in Guam. As a school psychologist myself for GDOE, I understand the magnitude of ensuring that mental health professionals serving our GDOE students are held at a high standard. Students within the GDOE system ought to have access to school psychologists who are trained and licensed under the Guam Board of Allied Health Examiners. And Bill number 295-38 provides a framework for school psychology licensure that established this qualification for school psychologist practitioner in Guam. Through this licensure, school psychologists in Guam would have the necessary education, training, the expertise to provide quality service that fulfills the needs and goals for GDU students, their families, and the communities. I've just been hearing the other testimonies of my other colleagues, and I really appreciate the stories. And I was sitting here trying to find out what type of stories I would like to say to influence and to advocate for this bill to be passed. And what I can come up with, instead of trying to read from my testimony here, which I will submit, was that I was working at the Guam Behavioral Health and Wellness Center before, maybe 6 years ago, before coming into GDOE as a school psychologist. And I remember working with adults who were in emotional pain, emotional behavioral pain, diagnosed with from adjustment to severe mental illness. And I remember thinking to myself that it's very difficult for them to live day by day in order for them to come out and come to the clinic and take their medications and go to counseling and therapy in order to kind of work on themselves. It's a very hard, long-term procedure. And I'm very glad that my colleagues who are there and myself were there to help the people in the community. But I also thought to myself, you know what? If we could help if only we could help these adults when they were little, when they were children, when they were adolescents, we could some sort of intervention or guidance so that they could prevent their lives from being very difficult at the time. So one of my goals, my thoughts were at the time were for me to work with the population, with the childhood and adolescent population, so that I could help prevent the struggles that children, adolescents will have when they become adults. One of my goals was to help them to live a fulfilling, productive, happy life. And so that's my thought and my goals when I'm working with students at this time. My colleagues and I, we worked very hard every day with students who struggle who don't want to come to school, who are depressed because they don't want to be seen by the other students. They're having substance use, they have depression, they have feelings of hopelessness, anxiety. And so school psychologists are deeply needed within our community, within our hometown, our island. And so I want to encourage all 12 senators for having us here to advocate for this bill. It's greatly needed. So I encourage the senators, please vote pass this bill. Lastly, I would like to thank Dr. Mamie Balhaja. Thank you very much, Dr. Balhaja. And also to thank you to Nadine Cepeda and Chairwoman Senator Matanane for making this thing happen, for having us here to advocate, and to my superintendent and to my Student Support Services Administrator for their deep support. So thank you so much for this opportunity.
Thank you, Dr. Cruz.
Good morning, Hafaday, Senator Sean Gomatautau, Senator Sabrina Matanane, Senator Therese Terlai, and Senator Telo Taitagui. Thank you for allowing us to be here this morning. I'm here to testify for Bill 29538. My name is Sonia Pablo, and I currently work for the Guam Department of Education as a school psychologist. This bill will allow current psychologists to be employed, and this bill is really urgent, is critical, is necessary because we need to continue to provide services to our students. In my role, I have witnessed the critical impact of our work on the academic success and well-being of students. In particular, this bill is vital as it more accurately reflects the specialized nature of our work. School psychologists play a distinct role in a school setting by conducting psychological assessments, providing mental health support and counseling, collaborating with teachers and administrators, and helping students overcome barriers to learning. However, on Guam, the number of school psychologists available to serve the needs of the GDOE is severely limited. There are only 6 of us to reach across the whole entire district. I mean, we're looking at 23,000 students to be able to accommodate, right? It's difficult. So the lack of sufficient school psychologists in Guam has led to an overwhelming responsibility for those of us currently working in the field. So as you can see, the 6 of us here, we have there's a lot of demands across the district that needs to be answered. So we need to be able to address also the mental health needs of our students. So this creates challenges, many challenges that even our stakeholders are not even aware of. There's really complex cases that have came about also because of COVID-19. And even with that, there's still some lingering remnants of the whole pandemic that we still see today, and many people are not really even aware of it because the kids are still somewhat anxious. They have trauma from that, and so because of that, we really need to still be on the forefront of all of this, and that's what we do. We provide that support, and we advocate for our students so that they are heard and they're best felt in the school system, because if we don't do that, who else is going to do it? Who? Us. And that's what we do, is we create that voice for them where no one can hear them. And so I best want to say that it's absolutely apparent that we provide that support and we continue to be there. So with this bill, this will allow us to continue to serve us in that capacity so that we are not just a bystander. We need to be able to really speak up for them because no one else will. And that's what we do in the schools when we go to our meetings, our staffing. We are able to say, hey, let's take a look at this, let's take a look at that. Because if we don't create that support for them, then it's very difficult because the academic setting is one setting, but when we come in as mental health professionals, as school psychologists, we play a very, very distinct role. And I strongly recommend that we hire more school psychologists who can be able to function in that capacity. So senators, I implore you, and I sincerely hope that we pass this bill in order to provide that continuity of services that so badly need in our department. Thank you.
Thank you, Ms. Pablo.
Thank you. Hafide and good morning, honorable senators. My name is Jesse Boleto, and I'm a psychologist with the Guam Department of Education Behavioral Health Services Program. I respectfully come before you and request your support and adopt the proposed legislation that defines and strengthens the title of the school psychologist position and to protect those who currently are providing school psychology services through a grandfather provision. School psychologists are uniquely trained to assess learning and address social emotional needs. We provide evidence-based interventions to support students and their families. We consult with school administrators, school counselors, teachers, and their families. And we support school-level systems strategies that improve school climate and student outcomes. School psychologists are involved in early identification and intervention to reduce special education referrals when appropriate, improve attendance, We collaborate with community partners to lower suspension rates and aim to increase academic achievement. School psychologists play a crucial role in crisis response, suicide prevention, trauma-informed care, and other behavior support services to maintain students engaged in learning and preparation for life. Supporting school psychologists is an investment in supporting schools, preparing productive students, and building resilient communities. Thank you for your time and consideration.
Thank you, Mr. Boleto. Angie.
Hafidane, good morning, Senators. Senator Sabrina Salas Matanane, thank you. For Senator Therese Terlahi, Senator Tello Taitagui, and Senator Shango Matauta, thank you. My name is Evangeline Cepeda. I'm coming here with a different hat. My hat is as a parent and as a board member, a former board member of the Department of Education. Okay, so first things first, why I ran for DOE for 3 terms. I ran because I had a child with special needs, and when I not physical disability, mental, and without violating his rights, I tried to work with DOE. This was years ago, okay? 20 years ago. There was no assistance. Go to Division of Special Ed. That was the process. Go to mental health. That was the process. At the time, they had a school psychologist, but that was more of a survey base, research base. It wasn't to step up and step out. So, as I usually do, instead of griping and complaining, I ran for the board. And I fought to get federal programs and Division of Special Ed as I chaired that committee. The first thing we did work on was IEPs and the HIPAA law, working with the students, working with the parents. We took a very proactive approach. Change was difficult. I was the enemy, okay? I was inside, but I was the enemy, trying to tell these experts what I needed as a parent and as a board member. That was tough. You know, that change is really tough. I'm a tough person. I'm okay with being the bad guy. I'm okay with that. I can live at night. I can sleep at night. That was one thing. Then we saw okay, Ms. Cepeda, we've got this section under the federal law. You can't change, you can't do this, but you're violating the HIPAA law. You have the nurse talking to the clerk about my son. What's going on here? You violated every right. So I spoke up, I stood up, and that has changed. It's come full circle, and I'm glad for that, because children need to be protected. We live in an environment where stigmatism is very high. There's a reason why mental health people don't want to go there. I'm not embarrassed to go in there and say, I need help. But how many of them are? There's a sense of stigmatism. Oh, you're mentally sick. You're bipolar. You're got schizophrenia. Whatever it may be. We live in that society. All across America, it's still, there's a strong stigmatism. And I'm saying to you today, we've come now, even to today, there's a resistance. I'm not going to sit here. I'm going to tell you that yes, my sister Nadine Cepeda, she's the youngest and I'm the eldest of 5 sisters. She likes to think she's stronger than I am, but I'm more vocal. And sometimes I'm okay with that. I'm Chamorro Nation at one at its best. With that said, I'm here because I'm not advocating for my sister. No, I'm not. I'm advocating for the position of this bill, proposed bill 295-38 LS. Fighting for this to be a part of the group that 30 years ago, school psychologists, come on, send them to mental health. The people demand more today. They expect more from you and I, who sit and wear a different hat. They expect it and they demand it. You hear this from people everywhere. We fail them if we do not pass this. There should be no one in this table or anyone that's going to write a testimony that is anti this bill. Stop making it difficult. This bill is very simple. Add this to the table. Make this be essential. Why? I'm going to tell you why. Our children are fragile. They are fragile. They feel depressed. They want to hang themselves. Nobody wants to talk about that. It is a fragile state. Nobody wants to discuss that. We'll leave it to the experts. I have to call Mr. Anderson. Mr. Anderson has to call my sister. Crazy. And I'm passionate about this. Too many of our youths have died, taken their life for something that should have been dealt with. This mediocre crap, it upsets me. Oh, let's go through the process. I understand about legality. Life, liability, legality, deal with it later. That's just my thing as a parent. And I had to fight this every single day. I had to say, screw the stigmatism. I don't care, Nadine. I'm going to mental health. My child needs it. But I'm one of the very rare. There's a lot that aren't that way. I'm here today to say, don't make this prolong this proposed bill. Put it into action. Put it to the table. Put it in place. So the kids, every day, I heard this from, these are experts. I'm not an expert. I'm a mother. I'm wearing a different hat now, charter schools. Just this year, charter schools, 4 people in our charter school committed suicide. That was devastating. I cried because I was thinking of their mother, the parents, the family. Then I had to call Mr. Anderson. Thank God he picked up, I think at 7 at night. I could have gone straight to my sister. I believe in proper protocol. I did that. I was called and I said, I need you to help my people. My counselors, my teachers, my students at this charter school were devastated. This is happening on our front doors and in our backyards. We don't have to look far. So anyone that's going to oppose this bill is crazy. I will be the first to say it. Crazy. Or have a political agenda. This is not hard to think about. This needs to be done. 30 years ago, we didn't have the counselors. When I was going to school, correct me if I'm wrong, you're my age. I won't reveal my age, but I will say this. When I was in school, the school counselors did this. Oh, Zanji, you have 3 credits to go. 3 credits and you're going to graduate. That's all they did. I'm not taking away from the counselors back then, but that was the need of that time. It's not the need of today. Forget about the 3 credits when you have a child that wants to cut himself. Which of the 2 lesser evil? Forget the 3 short credits. Work on his mental condition. And you can't do that with teachers. Teachers are too busy teaching. We need the experts. I am not an expert. But you decide. A child was cutting himself, life or death. And I hate it. I'm going to say this and I'm shaking. I hate it when they say, oh, we did all we can. That's not enough. That is not an answer I want to hear. It should be, did we do everything? And I'm loud about it because I feel like I want to cry. I'm passionate about this. Too many times. Depression, suicide. We don't know what else. They have bullying. When I was on the board, it was bullying. Wow. Something small, right? Bullying. Now it's, oh my God, crisis, depression, suicide. Wow. Times have changed in the last 20 years. This is critical. This is crucial. This is essential. This is like at today. That's what I'm talking about, senators. I'm so sick of hearing nobody wants to talk about it. Everybody wants to walk on eggshells. It's wrong. It's crazy. We come from a familiar system where when one hurts, everybody feels it. But guess what? We don't talk about it. Or we leave it to the experts. The 7, I heard the number 7, I wrote it. 7 on the entire island. You gotta be kidding me. When I'm calling my sister and I'm saying, how is mom? I can't talk to you, I'm on the phone. What? I drive to my mom's house, taking my elderly mother, and my sister's on the phone. Do not disturb her. She's in her room, which is her conference room. This is what I see. And then I have a brother-in-law who's a doctor in this. My sister's in forensic psychology. So it happens to be I live with people that these are the experts. So I have to say, I beg to differ. And sometimes I am not the expert, but I'm the mother. I'm the person that deals with this. Okay, so I'm here today in a capacity as a mother, as a parent, as my hat as the chair in charter school, 4 deaths, suicide. This is important. The school psychologist is important. I don't, and I can understand why. The lawmakers back then, it wasn't a need because there wasn't this problem, this fragile state of emergency. Today it is, and today is needed. And Madam Chair, I'm looking at you, as I always do when I say this. This is a call for cry. This is a demand from you and your other senators to make this bill pass. It's needed, whether it be my sister or the next person. I'm not looking at the name. I'm looking at the title and what that title holds. It's a cry for help. Don't wait for next year, the legislature. I know it's election year. You can pass this bill. And I implore the 15 to pass this bill. It's a cry for help. And with that, I don't mean to, I'm speaking from the heart here. I want to say that we are in a crisis. The youth are fragile. Since COVID, it's gotten worse. It's gotten worse. And our people demand and expect more from us for less. What I mean by that is they want more from us. And unfortunately, I'm one of those senators that say you deserve to get paid more. I'm not embarrassed to say it. You deserve it. Because unfortunately, we live in a community where you would go to church and someone would say, Senator Sabrina, I'm sorry to bother you after Mass, but I got this problem, the hospital. I'm giving an example. Your job is nonstop. It's a tough job, and you can't please everybody. But you could try to sleep well at night, like I say. I sleep good at night because I don't offend it. If I offended anybody, it wasn't to offend anybody, but I will speak my truth. So I come here before you, and I say no more. Please pass this bill, Bill 295-38, with the 15, and I hope they hear this today because this is an urgent, dire need. Thank you, senators.
Thank you, Ms. Cepeda, and I hear you. And that's why when we first spoke with Nadine about this bill, we acted as quickly as we could, and we were sharing stories. And when you brought the bill to our attention and the need and how there's only 6 school psychologists, and Vanjie, when you were talking about 20 years ago, my goddaughter, she took her own life. And had they had the school psychologist then, maybe she would still be with us today. And so yes, when I got the bill, moved quickly. I didn't even put it out for co-sponsors. It was like, let's get this in today. And so I'm glad we're here today. And this bill is having a public hearing, and I'm going to try my best to get it out and get it passed during the May session. So, Mr. Hahn, or... Okay.
Hi. Good morning, Senators. Senator Taitagui, Senator Chalahi, Senator Gumatauta, most especially Senator Salas Matanane. Thank you for the opportunity to speak today in strong support of Bill number 295-38 to establish school psychologists in our schools. My name is Rebecca Morta, and I am a parent of 2 wonderful students at Ontalan Middle School. I come before you today because I firmly believe that our children deserve to have the emotional, mental, and psychological support they need to thrive academically and personally, and this bill can make that a reality. As a parent, I've witnessed firsthand the growing challenges that our children face in today's world. From the pressures of academic performance to the mental health challenges brought about social media, substance misuse, bullying, and family trauma, many students are struggling in ways that are invisible to most teachers. administrators, and even their peers. While our educators do their best to support students, they often lack the training and resources to effectively identify or address these issues. This is where school psychologists can play an essential role. School psychologists are trained to assess, support, and provide interventions for students' mental health needs. They serve as critical resources for students who are experiencing anxiety, depression, substance misuse, behavioral issues, or emotional struggles. By having a qualified school psychologist on staff, we not only ensure that our children receive the support they need to overcome these challenges, but also help create a healthier, more supportive learning environment for all students. For example, I'm a peer mentor with Togi. I have seen firsthand how children and families struggle with family separation due to substance use and mental health challenges. My children are resilient as I worked on my recovery. And they were going through some emotional challenges. There was no immediate access to a mental health professional who could provide targeted strategies for coping in schools. Without that support, the issue only escalated, affecting my children's performance and well-being. Sorry, excuse me. A school psychologist would have been able to step in sooner, offering interventions and connecting us with the resources we needed to address the issues before it grew larger. Sorry. I've taken steps to represent Togi and collaborate with the Guam Department of Education to establish the first ever Hope Dealers Coalition at Okuru High School. This coalition is student-led, which turns negative into positive and makes students believe that they can change their life choices for the better. We have an amazing team of students wanting to do so many things, and we are in support of this effort. Additionally, school psychologists are crucial in helping to identify students who may need specialized services, ensuring early intervention for learning disabilities, emotional disturbances, and behavioral issues. Early support can make a world of a difference in a child's academic and overall mental health. Research shows that students who receive psychological support at schools are more likely to have improved academic outcomes, better social emotional skills, a greater sense of belonging, and school psychologists also work to train teachers and staff to create a safe and inclusive school environment, thereby benefiting the entire student body. In closing, I urge you to pass this bill and prioritize the mental health and well-being of our students. By establishing school psychologists in our schools, we take an important step in providing the support our children deserve. This is an investment in the future and the future of our community. Thank you again for your time and consideration.
Thank you, Ms. Morton. Is there anyone else here that would like to testify on Bill 295?
Okay.
Brian? Okay.
Hello? Oh, okay. Thank you. Manana Jesus, distinguished senators, and Hafaday. I don't know, there's not really, I think everybody has said it's so apparent and solid of why we should pass this bill, or why, not me, but the distinguished people should vote on this, and let your conscience and God and what the right thing to do is guide your decision with that. By hearing everybody's testimony, and I could feel the energy in the room and the sincere and genuineness, and it was really touching to see that everybody pretty much has been touched by these kind of situations. So I don't really, there's not from, everybody has said everything that they could say, and it's so apparent, and it was very moving, and it's very sentimental to me as well, because I have 5 children, 4 are still in the school system, so it does affect me directly. And like Rebecca, we both work for, or we support and represent Togi, an organization that supports these things. And we've been blessed enough to be able to been given an opportunity with the Department of Education and their amazing team to go into the schools and to have a counseling approach, a clinical and as well as a peer approach with lived experiences to support to try and reach the children. And we've been in the schools, and it's really sad. We were really blessed to go into Price Elementary from kindergarten to 5th grade. And, so for suicidal ideations, how do you do that when a kindergartner to a 5th grade? And if it wasn't for the Department of Education and Nadine Cepeda and also a few other peers like Rebecca, we wouldn't have been able to, I think, have a positive impact. And if it wasn't also for that counselor who reached out to our organization to have that situation, I think that wouldn't have been an opportunity to do that. So like what you were saying, Senator Sabrina Salas Matanane, if someone was there for your family member that passed because of that, maybe that presentation, us being there at that school that time, might have maybe saved a life. Who knows? Because we can never really, know that for sure. I do know that, and all the data shows why we would want psychologists in the school. It's a two-pronged thing. You need a village to save a village. So if you just have educators, well, who takes care of their mental health? So that's where the psychologists come into play, where they're trained and they have the background and they have the passion and the desire to want to help the children. And also there's a thing called ACEs. It's called Adverse Childhood Experiences. 64% of adults have at least one adverse childhood experience, which is neglect, abuse, or dysfunctional family environments, which is divorce, substance abuse, and stuff like that. So that's the reality, and that's in our families. And I've seen that firsthand. That's the reason why Togi has taken a different movement into going into and trying our best to reach out to the youth, and that's why we did the Hope Dealers with an expert from the States named Jaria Martin, and we had a team with Department of Education, with Jaria Martin, the Hope Dealers, and also to get together so that we can at least try and do something about it, like Miss Cepeda's sister said. So not actually just talking about it, but actually doing something about it. So at the end of the day, I'll just leave you with this question, and I've seen it because I had people like others here take their life. A young basketball player, he's only a sophomore, a year or two ago, he took his life, and he was at JFK. I even had another, a doctor, her son was a senior at Harvest, and then one day he looked normal, she said, everything was good, she woke up. He wasn't there in the kitchen where they have breakfast together. She went into his room and he had took his life. So you never know about these things, but the question, I do know that if we have child psychologists, because they've even been there for my children, if you have them in school, you have having a footprint there. There is somebody that's trying to work on and support a child's wellness. And I think that's very important to have in our schools. And if we can execute that and have it done, then I think it's amazing, and I think we need to get that done. But I'm just a guy, what am I saying, so. But the question I'd like to leave you with is that I ask myself, even when I have to work, and why do I answer a call at 3 a.m. when a peer is calling, or why do I do this and go out and do crisis intervention and take someone from GRMC or Guam Memorial Hospital to Guam Behavioral to go into the inpatient adult unit or the detox center. I ask myself, how much is a life worth? So I implore you to think about that question, is how much is a life worth when you think about passing or not passing a bill? What is that? What is one life worth to you? Thank you. Sisus Masi.
Thank you, Mr. Hahn. Is there anybody else that would like to testify on this bill? We will now open it up to questions. Senator Gumatata.
Thank you so much to the panels that were here today, and thank you, Madam Chair, for having this public hearing. Madam Chair, I studied psychology in college because I believed in the power of understanding human behavior and mental health. I interned at a child guidance clinic because I wanted to see that belief put into practice. And I sent 3 of my children to Guam's public schools because I believe in this community. This particular bill sits at the intersection of all three of those things for me today. I have just a couple of questions, Madam Chair, and maybe I can get maybe to perhaps answer. Does the bill require an amendment explicitly requiring licensure renewal? And if so, what recommendations should us as policymakers consider relative to renewal frequency and continuing education requirements? Or is the current law 10 GCA section 122324, which requires licenses to be renewed every 2 years, is it sufficient enough?
Currently, under Board Allied Health examiners, that is required of all professions under the allied health professions. So under the provision of the psychology section, we are required to have how many are there?
40 CEUs every 2 years.
I think it's 50, right?
It's 40.
You sure?
Yep.
Require, I think psychology section required the most of 40 continuing education every 2 years and 6 ethics. So it is the same requirement of all the professions under the allied health examiners. I think psychology has the most of, not 40, I think it's 50. Yeah, continuing education.
So you believe that it is sufficient enough?
I think we're following the national standards. I think when one wants to learn, it doesn't matter that you have somebody looking over you. You know, you get the continuing education because you're interested with in what you wanted to and be more learned, right? Learn it. So I don't know. I cannot answer the question whether it's enough because it depends on individual. So when we desire to learn more about the specific area in psychology they want to, they will do so. And perhaps they can also get certification to be an expert in the area, to learn more and become, yeah.
All right, thank you. The coursework domains required by the bill, psychological foundations, assessment, interventions, research, and ethics. Can you explain why each of these is essential to someone working with children in a school setting? I'm trying to get your help to help this committee understand what a fully prepared school psychologist actually knows.
All right, Senator Gumatao, these are the national standards. So if you're graduating a minimum as a master's degree, these are the required coursework. These are national standards. So we want to level the ground and make it national standards. So all these courseworks that we put, I worked closely with Dr. Mimi Balahadia, but these are national standards and this is a requirement to get a degree in school psychology. So these courseworks are all required.
Thank you for that. Recognizing the bill requires applicants to pass the Praxis 2 school psychology examination, what relationship do school psychologists currently share with the Guam Commission for Educator Certification, and will the GCEC serve any role with respect to school psychologists licensing, renewal requirements, and code of conduct complaints?
So currently, the Guam Commission does not certify school psychologists. They certify teachers, and this is where the rift, because of the psychologist title, they wanted to go back to the Guam Allied Health Board. So we were in limbo. So for myself, I'm using a title as psychologist and I don't have that requirement. That's why I urgently came to Senator Sabrina Matanane, because there's 6 of us, 5 of us do not meet that qualification using that title. Only 1 of us does. However, we've been providing these services. We've done masters, like I graduated from Cal State Sacramento with a psych degree. I got a master's experimental psych from Cal State Northridge, and I got a double master's here at the University of Guam. And even with that, we have really intense coursework and intense training, rigorous training. And so what we're saying is, if someone comes from the States and have these meet these criteria, that you meet national standard. And our people and our students demand that. Why anything less? Let's have them get the best people to help our students and work with our community.
And as a graduate of the California State University system myself, I appreciate your input as well. For the record, are school psychologists covered by the general pay plan, and how can the bill as drafted help confirm whether there's a need to move these positions to another pay plan or develop a standalone compensation study to help address recruitment and retention challenges for school psychologists moving forward?
Senator Gumatata, that's a very good question. My understanding is that it's not included in the general pay plan. I think with the passage of this bill, what will happen is the Department of Administration is going to need to develop a job description and a pay scale to support that position. So yeah, this is definitely something that needs to happen, and I appreciate everyone here helping us deal with this jeopardy that I think our psychologists, our school psychologists are facing, because as I mentioned in my testimony, they were hired as psychologists. That's actually the job description that's on the books for Civil Service Commission. And so they've been put in jeopardy when in 2022, the amendments were made to specifically indicate that in order for you to use psychologist in the title, you had to meet certain criteria that was more geared towards a clinical psychologist than just what these folks were doing in the school system. So yes, they're going to need to develop very quickly and ensure that there's some kind of compensation schedule appropriate for that position.
All right, thank you so much for that. And I have one more question, Madam Chair, is can you describe, anyone on the panel for this, or maybe they're here, can anyone describe for the committee the range of students who rely on school psychology services at GDOE? I know I heard it earlier, but I just want to, let me just ask again. Those students with learning disabilities, behavioral challenges, trauma histories, mental health needs, I want the committee and the people of Guam to understand exactly who we are talking about when we are debating the qualifications of the professionals that are in fact serving them.
And that's a great question. So let me respond to that. I wrote a grant for $1.6 million 3 years ago for universal screening. Guam is so behind. I'm not quite sure why our people of Guam deserve the best, but I came from mental health. We are 20 years behind, sadly. But I wrote that grant knowing what is the pathway to identify these at-risk students, and that's one of them. That $1.6 million paid for 4 social workers and a district school psychologist. With that, we're 8 schools. And this is why I said the data is alarming. We had 1,826 students oriented because Public Law 31-202, and I've been working with different senators even last legislation, it hinders and impedes in getting the informed consent for people to be screened in order for us to identify these at-risk students. Alarming enough, just out of 63 were identified high risk, had active thoughts, history, and attempts. If we didn't screen them, who knows? And the power of this consent, Public Law 31-202, has been a fight that DOE has been working in the last 5 years. And it's really, really concerning because we want a larger group of students to be honestly opt out so we can screen more. We give back the parents the power by saying, I'm letting you know, we do it right there. We activate the team, we screen them, we do a safety plan, we notify the parent, they consult with us, who's a licensed mental health professional, and if it's acute, we refer to Guam Behavioral Health and Wellness Center. So when you're asking how many, just that number is universal screening. How many are referred to us? It goes through a process, that MTSS, multi-tiered support system. It's very crucial because we all play roles. These days are gone when you're saying, I can't do that. I can't do that because that's on my job description. It takes a village to work with one child. And we need everyone in the playing field to help us, from teachers, school counselors, social workers, school psychologists. Everybody has an important role. So the question to give you that number, I do not have that number on you. I do know that number with the enhancing your mental health because we collect data. Data drives what we do. And I can provide that and make that available to you, but right off the bat, that's just 8 schools. And we're only doing 1 grade level, 7th grade in the middle school, and that's 4 schools, and 10th graders in the high school, 4. We have more high schools and middle schools, and yet this is how you capture a larger group. Guam has one of the highest suicide rate. We know this. We even have a high rate of sexual assault. We are 3rd in the country. And that's one of the things we capture. The A's for adolescents is called the pearls. Do you know how many that we had to go to GPD and call CPS? It's alarming that we say familiar. Well, it's a lot of hurt when you violate people, when you feel neglect. School is the place to access these services because research indicates that they don't go because they don't have the money or transportation. It's in the schools that we can provide them. And I hope that answers your question, Senator Gumatauta.
You know, it does. And I think from the testimony here for today, you're absolutely correct that this bill is critical today. Why we had to wait nearly 2 decades to be able to get to this point, why we had to wait a very long time to finally get some level of support, especially with all the skills and all of the education you all bring. 5 of the 6 school psychologists, Madam Chair, testified here. There's one that's missing, but we have the full complement that are telling all of us that this bill is absolutely critical today to support the school needs of our Guam Department of Education's school students. And I know that you also are helping those private schools because they do sometimes, I know they call and ask you for support. And that just tells you that it's not just yours, it's quite broad. We should have not waited 20 years to bring this policy forward, but we're in 2026 now, and this policy is going to get us right where we need to be today and moving forward. Thank you, Madam Chair, for the time on this particularly and most important bill at this time.
Thank you, Senator. Yes.
Sorry, Madam Chair, if I could just expand on Senator Gumatauto's question regarding the number of students that we're looking at, the power of AI. It's 1 to 5% of a student population that needs specifically Tier 3 services, which is really the focus of our school psychologists. So when you look at DOE, if you do the math, at the low end, about 350 students, at the high end, about 1,500 students. Now, for Guam, it actually may be much higher than that. And I appreciate Nadine and her reference to the universal screening initiative that she introduced with this grant that we were accepted to implement. So with that screening process, we hope to fully identify all the students that truly need Tier 3 or Tier 2 supports. So we do have social workers and counselors, and we want them to focus on the students who need Tier 2 supports. But the psychologists can do, of course, the range. The school psychologists can do the range of services that are needed, Tier 1 to Tier 3.
Thank you, Mr. Anderson. Before we head to our next senator, I did want to just follow up on the superintendent's testimony regarding the qualifications for licensure section that references Praxis 2 in subsection 12A 1202C. She indicated that it should be non-specific in order to allow for alternative examinations that measure competency and national standards rather than a specific test name. Can you kind of, is that something, Ms. Balahaja, that you would agree with, that it should be non-specific? Or Nadine? Or?
Mr. Anderson, you may be able to answer that?
Well, I can do my best to, I believe I understand her position, that, you know, again, depending on, I guess, my understanding is that there are other tests or examinations for school psychologists aside from the Praxis 2. And again, depending on, you know, different changes in that workspace for school psychologists, that, you know, perhaps if there's a different examination that's more appropriate for our folks, that it gives the kind of flexibility to use alternative exams aside from just that specific one. So I don't think she has anything specific against the Praxis 2, but more just providing for flexibility for the allied, you know, examiners, the Allied Health Board to be able to work with different exam instruments.
Again, this is, I'm going to defer that because that is my superintendent. But when Dr. Balahadi and I proposed this bill, we worked closely together, that was just a national standard. And I guess after talking to Dr. Wampak briefly before we came in, she was saying is if you limit it, then it will be very difficult. And if, they're seeing that with some of the teachers. And so that's some of the things that she kind of wanted to be more flexible.
Okay. I just wanted to make sure we're not loosening any kind of licensure requirements, or we want to ensure that any kind of safeguards remain in place. So maybe we can just discuss that a little further later. Senator Taitigui?
Sijus Masi, first let me say thank you so much, Nadine, for bringing this bill to our attention, and of course those who came to testify on the bill. I sent a bill that would very much similar in November of 2025. Yep, this bill that I sent to you for a review, so I hope to hear from you soon because I think it's going to be very instrumental in complementing this bill, starting from the beginning. So I hope to hear from you soon on that. Okay, other than that, let's get to work on securing this bill for passage. So let me get some questions out for the Guam Board of Allied Health under nationally recognized standards established by the National Association of School Psychologists. Entry-level school psychologists are generally required to complete a specialized level of degree, typically an education specialist or equivalent, which includes approximately 60 or more graduate semester hours in school psychology, in addition to 1,200 hours supervised internship. So this bill, however, allows for licensures with a master's degree in school psychology, educational psychology, and counseling psychology without specifically requiring a specialist level program or equivalent credit hours. From the board's perspective, how does this difference impact the consistency and competency of licensure standards? And would you recommend aligning the bill more closely to the NASP's specialist level requirement?
Senator, could you repeat that again on the last part you were saying?
Basically, it's to, from your perspective, from the board's perspective, how does this difference impact the consistency and the competency of licensure standards? If you can stop the clock, I have to repeat the question. Hello? Yeah, can you stop the clock because she asked for a repeating of the question? Okay. For the board, let me go back again, okay? For the board's perspective, if you'd like me to read the whole thing again, I could, because I know it is, it talks about the requirements for specialized level and degree, typically for the education specialist, right? Or equivalent, which includes approximately 60 or more graduate semester hours in school psychology. In addition, 1,200 hours supervised internship. So this bill, however, allows for licensures with master's degree in school psychology, educational psychology, or counseling psychology without explicitly requiring a specialist level program or equivalent credit hours in this bill. So from the board's perspective, again, how does this difference impact the consistency and the competency of licensure standards? And how would you recommend aligning the bill more closely to the NASP's specialist level requirement? Feel free to answer it, and of course, Nadine, you can answer it as well. But I'd like to hear from the board.
Senator, in the field of psychology, there are different specialties, and school is one of them, and I'm clinical. So in the school psychology, under the national standards, and also when we discuss what is really special and pertaining to the local population, that could be also included and what is required, like cultural, somebody from area, and which is already in our law right now. So specifically right now pertaining to school psychology, that goes with the national standard, what is required. And basically also that the clinical hours of supervision, clinical internship, that is required because you need to have the experience under a person who's already licensed and qualified to be able to guide you in some way. That is important. That's the reason why that is. And that not only pertains to school psychology, but counseling, and particularly clinical. We need the clinical hours in order before you can be licensed. So we meet all the requirements as set up under the standards. And it could be, we could add on local. For example, right now, the counselors are required to have the cultural competency of the course in order to able to obtain the license. So even though it is specific in that area, it might not pertain like to clinical because the setting and the environment in which we work in are quite different. Clinical related to clinics, hospital, and also could be private practice care. School, you are dealing with bigger population. You're dealing with not only children, but also parents and your other colleagues and teachers. So the population is wider, so the requirement is quite different in a way than it would be, like say for me, working at a clinic, at a hospital setting, or private practice setting.
Yeah,
I don't know if I answered that question.
No,
though.
actually, it's not. It's because there are certain standards in the NASP.
Yes.
Now, how we are going to incorporate it into the Board of Allied Health. Go ahead, Namne.
If I may, I'm going to wear a different hat as well, because I'm also in the Allied Health Board. And I represent licensed professional counselors, licensed mental health counselors, and licensed marriage family therapy. So Guam doesn't offer a school psychology program. So that's one. Two, we are saying currently there's 5 of us that don't meet that criteria because I have a double master's and I did 600 hours in each program, which is a total of 1,200. Psychology is very, very particular that it's usually a doctorate degree. The exception is school psychology because it requires a minimum of 60 credits, just like a clinical psych or counseling psych. But it's the internship that is the 1,200, and 600 has to be in a school setting. They need to be proficient working with the different lifespan, right? The age group, right? Because a kinder would be very different what you see in secondary. And so just to get with technicality, we again, are trying to put the national standards because people who choose to go off island, we want our local people to come back. And that's why, Senator Tello, we put the grandfather provision because we've met the 600, we've been working in the school system, we just don't meet that criteria. And so that's reason why we want people to come, and moving forward, we'll meet that national standard. So great question. It's going to be issued by the Guam Allied Health Board. And with that, those are the school courses. You look at the NASP, that's the one that says 1,200, and it needs to be from a licensed school psychologist. We're saying because we worked on it, that's why we're really, or I'm gonna say, I'm emphasizing on the grandfather provision. My degree, again, is not in school psychology. It's in 1, experimental psychology, and then 2, I have a counseling degree in both tracks, school counseling and mental health.
Okay, so the NASP, you don't feel that it should be integrated into the Board of Allied Health requirement?
So technically, we're talking about certification, that if you met that criteria, then you meet the standards because in most states, that is the requirement with the 1,200 plus supervised by somebody.
Again, incorporating it into the Board of Allied Health's requirement.
So the NASP to be part of the Allied Health.
That's the NASP's requirement.
And that's the certification.
I think that we're looking at certification, and the board is going to be working on certification That would be the answer to it, correct?
Okay. Yes. So there are things that we were looking at is licensure, because that's the higher policy. We were looking at certification, and that certification was say 60 credits. Looking at if you're an NASP, you'll get the certification right away, but we're building into what that looks like at this point. And she does have, she can consult with the ASP because there's a division in APA, American Psychological Association. So we're working on that to say, if you meet that pathway, you'll get certified. We're working on the second pathway that the Guam Board of Allied Health can issue on certification.
Okay. Would you be open to clarifying in the bill that the practice of school psychology is limited to educational settings and does not include the independent diagnosis of treatment of mental health disorders beyond school-related learning and adjustment needs?
Did you hear that name? Would you be open to them adding that in to the
Feel free, Nadine, to answer the question because I know you wrote the bill.
Okay, so yes, thank you. I'm okay with that. The only thing is in our current law on the LPC, LMFT, they can diagnose. And I know this has been a contention because LPCs are general practitioners. LMHC is a specialized for diagnosis and treatment, and LMFT is a specialty licensed with marriage and family and couples. So when we think about this, they can do that. I hold all three licensure, and that would be my thing is perhaps we can go back and I can work with Senator Sabrina so I could do more research. Because if you're right, it's a school setting, but all of us hold a current license with Guam Allied Health Board, which does allow us to diagnose based on our LMHC, LPC, or LMFT.
Okay, so would you support including a provision requiring referral to a licensed clinical psychologist or appropriate provider when a student presents a mental health condition beyond the scope of the school's based services?
Okay. I'm going to thank you again, Senator Taitigui. That's something I don't want to be so in haste to respond. I would like to just kind of settle with that, and sometimes it just registers because this impacts everybody. And I kind of want, like, I'm one to love to do research, and so before I say anything and provide you a response, I would like to kind of go back and let it register and read on that and provide Senator Sabrina back into that amendment, if anything.
Okay. Yep, there's a markup meeting, usually afterwards to make sure that we have a clean bill that comes in front of us so there's not that many questions. So now that I have Vanji here, so Vanji, my question is, do you think that this bill allows for the same treatment in the charter schools?
Absolutely, Senator.
It doesn't say it in here, though.
Here's the thing. Remember, on all my public hearings, I say, this is not anti-charter, anti-GDOE. This is the children of Guam, the kids of Guam. So when I, like with this forced suicide case, okay, in the charter school that happened recently in one charter school, it was because the friends were being separated. They were all connected by soccer. This I know for a fact. And some had to go to a charter, some had to go to GW. And it was just something for me that for me was very minute. And how could you take your lives? So I immediately called my sister. My sister goes, you can't go through me. You got to go through my boss. And I was like, OMG. That was my response. You got to be kidding me, Nadine. I did that. I called Mr. Anderson. Mr. Anderson did have my sister call me. I said, I need the school to be addressed immediately. And they took action. They did all that because mentally, I needed my school administrator, the teachers, and the students that this impacted in the charter, which is even smaller, to be cared for, and it was delicate. So yes, Senator, this, I've not had problems as the chair. We have not had problems when we tap on GDOE. I will applaud them that as busy and as overwhelmed, I like to think that we all serve the same children, the children of Guam.
Okay, again, would it be prudent to include this also includes charter
Okay,
school.
thank you.
So we have to add
Thank you,
this.
Senator, for
Yeah.
always being proactive to the charter. I appreciate it.
Absolutely. I'm the
Thank
biggest
you.
fan. You know that.
I know. Thank you very much.
Okay, again, so Nadine, the question, of course, is, adding certain amendments to the bill to clarifying or distinguishing a school psychology from a clinical psychology in the bill. And we make sure there's any concerns of any overlapping that should be addressed. So that's one concern. And the risk associated with school psychologists conducting psychological assessments that may approach clinical level evaluations that should be addressed in this bill. Do you think that should also be concerned to add any kind of clinical level evaluations?
So Senator Taitigui, just to go back, that's the reason why we define school psychology, because we're not encroaching. We need to stay within our scope of work, our level of education, and our training. And so it's very clear how a school psychologist is different from a clinical psych. That's one. Even the course requirements are different. I'm a graduate student working towards my PhD in forensic psych, and the courseworks are really, really intensive. So I think truly we covered that in regards to the breakdown of the coursework. But I will get back to you again about the supervision of the 1200. But everything else, I think we worked very closely to look at the national standards and see how we can, again, if someone was to come here and they meet the national standards, that they will be able on the belt to again, if there's an opening to qualify for a school psychologist.
Okay, go ahead, Mr. Anderson.
Yes, thank you, Senator Taitigui. Can I just get clarity? Your comment was, can we include the charter schools in the scope of services being provided by school psychologists? Was that your...
So basically there are risks that are associated, with school psychologists and conducting psychological assessments that may approach a clinical level evaluation. So that should be addressed in this bill. And should it be addressed in this bill?
Well, yes, and theoretically, I completely agree with your recommendation to ensure that we don't make a distinction necessarily between DOE students and charter school students, nor private schools for that matter. I'm just going to comment that, pragmatically, as referenced by Dr. Santos earlier, the ratio of psychologist to student, school psychologist to student is way out of proportion already. With the Department of Education. So if I could just encourage perhaps that we add language that allows the department to be able to recruit more school psychologists to reduce that ratio, right, so that we can be more effective in addressing the students of all students on Guam, aside from just DOE. So yes, we would love to be able to provide that support. It's just that it's already challenging, and that's just increasing the challenge of the existing 6 school psychologists. Thank you.
Mr. Anderson, since I have you, what is the current process of referring students with serious mental health needs to clinical providers? And should this be codified in law to give you that ability to do so? Because if you recognize them, in fact, the bill that I'm working on with Natalie right now, it provides training. So does the school have that ability right now?
Well, we currently have internal protocols for how DOE schools can refer students for behavioral health services team support. But if we were going to include, charter or public or private schools, we would just extend that to them as well. I mean, we currently do that now. I think when we provide crisis...
Is it codified, the ability for you to do that, to refer? Or it gives you that ability to do it?
No, I don't think it's necessary to necessarily codify that, but...
There is a process, though.
Well, there's a process in the sense that when schools like Banji had referenced, right, when they needed support for crisis incident debriefing for a situation that was happening at one of their schools, she just reached out and we provided support. So it's not that we need legislation in order to do that. It's the issue of just the number of providers that we have to be able to effectively address the needs of all students. And, again, I think if we're able to recruit more school psychologists, that would help us to greater meet those needs. And to, again, Senator Matanane's question about the issue of, providing alternative exams Again, I think perhaps that's also part of the issues that we've been experiencing with teachers being able to pass the Praxis 2 for their areas for teaching certification. And so again, I think it's a good question about, are we trying to, water down the standards, I guess, in terms of how we're recruiting and hiring school psychologists, and that may be possibly true, but I think on a bigger level, the issue is just making sure that we're not limiting our ability to hire more school psychologists on Guam. And again, some folks they're not good at taking exams, but they're excellent at providing services. We have teachers that demonstrate that all the time. So nonetheless, I would like to think that Dr. Wampat's position is not necessarily to water down standards, but to put us in the best position to be able to recruit and place the folks that we need.
Okay, so basically, we're asking if we should clarify in the legislation the definition of school psychology that only states public school systems, quote, that we expand to include charter schools and private schools, incorporated. So that's a language that we need to look into. Natalie, we need to not all of us senators are invited to these markup meetings, so hopefully if there's anything I can provide to you when you go into this markup meeting, that I'd be happy to. Because a lot of times leadership changes, we need to get a lot of this codified into law to ensure that the process is met with good intentions and is correct, and the liability issue should be a concern to everybody on their perspective. So other than that, I have a meeting I have to attend to and I have to excuse myself, but I didn't want to miss the opportunity. Yes, go ahead, Mamie. You had a question?
Senator, let me just make a point about licensure. You do not, in the law, you do not want to be so specific that you want to be general, that basically individual meet the qualification in a general sense of following national standards. Because when you have individual coming in, that if you have things specifically says, oh, you have to have this and this, if you don't meet that, then you don't qualify, then we're really not going to have a workforce. Because right now, am I able to go to the school system, for example? Right now, we are short of school psychologists. And with the one that we have right now, to me, as you can see the numbers, it's not enough. So as Mr. Anderson indicated, that if another person comes in, if they meet the basic licensure requirement, and they like to hire this person after interview, that they should be able to. Because we want to make it so specific, then there's going to be limit into a pool of people actually be able to provide the service. We don't want to make it so stringent that people are not be able to qualify. But I think you want to put it in basic following national standard, and that's the reason why that's not answering some of the question you may have concerning about specific qualifications.
I totally understand the need, but things are put into perspective to allow individuals to have the schooling and the knowledge and the training before going to our children. There's a protection issue that I'm concerned. And for those individuals who took the time to study, to get their degrees, to get their internships, and stuff, we can't disregard them and think everyone else, you don't have to go through this process. That's not fair to those who go through the process. So grandfathering is one thing, but also providing a safety mechanism to the internship, the requirement, and the National Association of School Psychologists put these things into play. That's been studied beyond your capabilities to understand in this environment, it's totally different. So I don't want to lose sight of that, because our kids deserve the best, not just half. They deserve the best. So, and I think I'm not as emotional as Vanjie does.
No. Let me just say,
I'm going to keep it cool. She basically spoke for us.
I always say that with people that knows me, and I don't know whether it's appropriate to say it in the legislative setting, because there are people who are doesn't have the proper, let's say, education, but they're really good in doing what they do. I can tell you about psychiatric technician. There are a lot of people with education. There are a lot of PhD that are, to me, there are a lot of stupid PhDs. I'm sorry to tell you, but there are a lot of people without the PhD. They're really good in dealing with the people. And so we really have to look at the person. And basically, yes, we do need the credential. We need the requirement that said basically they have the proper education and ability. But when you hire them, you find out, gee, where did this person go to school? I've said that to several licensure people. Where did they go to school? Because they're not able to provide the particular aspect of the need and the requirement. It is they come from good school, but I don't know where they go to school. That is based on complaint to the board.
Sounds like a liability issue.
No.
Okay, thank you.
Thank you.
Senator Terlai.
Thank you. Thank you all for being here to testify on this bill and for doing the work that you're doing. So I just want to acknowledge right away that I agree with that if we want to set a standard that we all believe that the students deserve in the schools, that the school psychologists should have a certain standard. We're going to follow the national standards. That's excellent. And the board has agreed to license these, so they will have a specific credential licensing here on Guam. And that's going forward. And so this is great for the students. So I have no issues with that at all. My issues are with DOE, I guess. It's kind of like, so we hear different things today, but some of it is addressing DOE's needs. But I feel like, so the bill is not necessarily addressing DOE's needs or capacity or ability to hire more or recruit more. It might actually be limiting DOE's ability to hire immediately because we're raising the standards and we're not allowing any more. Some of the people that we've already hired would not qualify under this, right? So there's a grandfather clause, which I don't object to, and I want to acknowledge all the work that you have been doing. But I guess, see, that's I feel like maybe we need a separate legislation to address DOE's needs fully, right? Like you talk about the ratio and that. But so, for example, if you could just clarify maybe, does DOE, they have a counselor's position, school counselor, and a school psychologist position, two separate positions?
Well, we have two different employees who provide those kinds of services, but the Department of Education, when they hire school counselors, they're hired as teachers and slotted as school counselors. So there's no actual position for school counselor. And then currently there is no school psychologist position. The actual position, as I referenced in testimony, we're using the job description from the Civil Service Commission that was approved back in 1980.
Which is what?
Psychologist. That's the actual title of the job description.
Okay.
And so, to your point, this particular bill is really trying to address the immediate need, which is the jeopardy that our 6 psychologists, because that's what they were hired as, are currently in right now. In terms of their ability to meet the requirements as stipulated in the law. Okay. And so in 2022, when they amended the law to require certain standards that are more appropriate for a clinical psychologist than just what a psychologist or a school psychologist in terms of the role that these mental health professionals were providing. All
right, so it's a grandfather clause that's urgent.
Yes.
Because you've already slotted them into psychologist slots.
That's how they were hired, yes.
All right, but what about the changing of the civil service position descriptions? You said DOE would have to work with DOA to do that. Have they started that at all or not?
Well, they have, my understanding is DOA has been working on the job description specific to what the public law required in 2022. They have not been working on a school psychologist position, which is what we're hoping is when this bill passes is going to require that. And then therefore the folks that we currently have in the department now will continue to be able to provide services to our kids.
All right, so you will address that they will be able to continue to provide those services and fit into those slots. But in recruiting additional, it's been, well, one of the testimony from Sandra Berdalio says, for years, Guam has faced challenges in recruiting and retaining professionals with doctoral level school psychology credentials. And I think that must be correct because there are apparently none right now. So we're making it harder for you to recruit into those positions instead of changing the job description so that you can recruit, for example, you know, these others who are qualified in another way. And maybe have, and they say, some of them have said they even meet a lot of this criteria, except that they do not hold the doctoral or master's degree specifically in school psychology, educational psychology, or counseling psychology, but some of them are, they've got the PhDs in clinical psychology. I mean, do we want to exclude them? Because to me, that's the risk we might be running here, is now we have to exclude them when you have an immediate need, and we have to wait for a licensed school psychologist to come, as opposed to hiring a licensed clinical psychologist or all these other things with maybe years and years of experience in mental health. That's my only concern is I will agree to this. I agree to the standard. I agree to the board's position, but it's just GDOE. I'm afraid I don't want to come in a month and say, oh man, we have all these 5 people now that we should really put into the schools right now. We can help these students, but they're not this. They're not PhDs in school psychology or educational psychology specifically, right? But they're experienced and they're qualified. So I guess that's just my concern. Yes, Dr. Mamie?
Senator, on this island, there's many individuals with master's degree, and they're being found out all over the place according to what their desire to work at place. And I think setting this in motion is going to maybe attract later, I don't know, more people to desire to work for the school system. All you need, the qualification minimum is a master's degree. There's a lot of master's degree recipient, you know, in this community. So that is very important. But I don't think that, I don't know, everywhere, even clinical. I mean, this island is really lacking a lot of profession in providing the services. So perhaps from the long term, I mean, just, you know, since you're asking a question, is to encourage individuals to be able to go and the government to support our local people to come back and serve the community.
Yes.
However, because I find in my experience of working even at Department of Mental Health and Substance Abuse, there were people then, like, they come on island, you know, they're able to fill a position, but they don't want to stay and serve the people. So we wanted to invest, to me, into our own local people, encouraging to come back in this area. Psychologists, we don't have very many. Yeah, so that's another thing maybe the legislature can think about how we're going to be able to do that. But in the meantime, I think it's so important that individuals who's been working with the school system, they rightfully should be school psychologists. That's why this came about.
Okay, so I understand, yes, that we have we want to grandfather those. So I'm just, and then maybe, again, so no problem requiring or having a licensed path for school psychologists in particular. And so that's one thing, I think, separate from DOE, really, even though we've been testifying about it kind of together. So we have a school psychologist path, but I think DOE has to really consider what their requirements are going to be for those positions. And that's, I really think you need to urgently work with DOA, not wait. We've seen other agencies where they've been waiting for years, and I would recommend you don't wait if you think that's the issue, in order to try to recruit more. If you're trying to recruit more, how many openings do you have? Are you trying to recruit more?
Well, I mean, We are trying to recruit more in terms of the current standards and requirements. However, that's determined. That's budgetary. That's the ability for us to get the approval from the superintendent to be able to, fill those requests that we have put forth. But in terms of the Department of Administration, they're going to need this legislation that provides this caveat or this, opportunity to have a school psychologist position, because there isn't one right now. So they need legislation to tell them otherwise. Because my understanding is they're working on an actual job description for a psychologist.
Yes, and I'm saying maybe you need to address that right now, where you instead of requiring a licensed school psychologist in those positions right now, while you're trying to recruit, that you have to control that, what they're going to recruit. Yes.
Pardon me, Senator Terlahi, it's already done.
We haven't seen
So Dr. Balahadia actually worked on it based on the law. Again, we're trying to fast track this because
the position descriptions?
Right.
Oh, okay. So what are they? Can you read those to us then?
Sure.
So
can make that
how does
available.
she work on the DOA?
It's because we actually have been working on this simultaneously. Senator Sabrina Matanane responded very quickly to our need. She was asked by somebody else to assist that in that process when I came to her. And so she is familiar with how that's done because she's written several different position descriptions previously when she was the clinical administrator at Guam Behavioral Health. I mean, I'm talking like she's the second person, she's not here, so I'm going to defer that, but it's already written because Dr. Balahadia was asked to assist in that process when I came to her.
So we could DOE, have you seen this? It's for you, right? So I would just like to see, and I think you should just compare then the current hiring standards, even if we grandfather them in right away, still you're going to have a standard of hiring in these positions or further hiring in these positions that really might limit you. But I think there's a way around that, and that's why I want to see maybe what you've already written.
Yeah, Senator, the job description is already written, it was given to the superintendent.
Okay.
The next step would be to go before civil service if there's any question.
Okay, great. All right, yeah.
Well, I'm pleasantly surprised to know that. Thank you, Dr. Balahaja. I know our HR Administrator, Catherine Atta, has already been in communication with DOA regarding this situation. And so I'll make sure that she's also tracking on the fact that Dr. Balahaja had already written the job specs for this, because yes, if that's already done, then we should be able to move pretty quickly once this legislation's in place.
All right, great. So this legislation will allow the 6 who are currently hired to remain in that position officially, even with the new job description, because we're grandfathering them.
That's correct.
But I think I want you to check again about GDOE's ability to recruit immediate. If you have this huge need, as almost all of you have testified to, the number of students, the great number of need, how limited we are in our capacity at this point, and I think we want to address that. And so hopefully if we can see that job description as well.
Well, and I appreciate your concern regarding making the position description maybe too difficult to or challenging for us to recruit. And so obviously we want to defer to Dr. Balahaja and her experience. And obviously she's worked with a lot of professionals here on Guam, and so I think she has a very good understanding of the difficulty with trying to recruit positions.
Yes.
So if she's in favor of adding language as well as the senators, if the body is agreeable to looking at some type of language that provides an equivalency thereof. So you set a standard and you're very clear about what needs to be done for a school psychologist, but there's flexibility to look at other aspects of that person, because as Dr. Balahaja said, there are plenty of PhDs that on paper are the best thing since sliced bread, but in reality and in practice, they're terrible. And then to the contrary, you have folks that don't have the credentials, but are definitely able to provide excellent service for people in need. So I mean, if that's possible, we would love to, we would welcome that, because
Yeah.
obviously we want maximum flexibility.
Yeah, I think that should be done on the DOE side, not on the licensing side. Their licensing requirements should be uniform with the national standards, but DOE's hiring, that's what we've done, I've seen in the government, where you have this degree or you have the equivalent, you know, these things, or the equivalency, and then they lay those out
Well,
in different
I don't
ways.
know how this works exactly, but I assume that DOA is going to work specifically with the language in the law. I don't know if they'll put that flexibility in the job
Well,
description.
that's why I'm pointing that out to you. I think that's most, based on the testimony I've heard, that's
Yeah,
what I'm
let me
recommending
verify
you
that, and
take
then
a
we'll
look
get
at.
back
Yeah,
to Senator
sure.
Matanane about whether or not they can write that kind of flexibility into the job specs if it's not in legislation.
This is tells us what a licensed school psychologist has to have
Right.
to be licensed on Guam.
Right.
That's separate and apart from what a school psychologist position in GDOE must have. And that's why I'm saying if you've worked on that separately, that's excellent.
Well, the
and
challenge
hopefully-
is
yeah.
you can't be hired by the Department of Education if you don't have licensure.
Right now.
So if if the Allied Health Board sets that standard for licensure, you know, folks are going to have to meet the requirements
But
in order
that's
to
under
get
the
licensure.
current DOE job description, which is what I'm saying. That's why you want to look at that DOE job description if you want to hire more people immediately.
Well,
But
my understanding what's going to happen, sorry, Senator, and I may be slow in understanding, but the job description for the psychologist, which is currently on the books right now, is going to go away. We will not be using that, of course.
Yes.
We will have a new job description. And I'm just saying that I don't believe the Department of Administration is able to write that kind of flexibility into the job specs, or even us to suggest it, if it's not specifically in legislation. And again, if the Allied Health Board uses that specific language and doesn't provide for any flexibility, some language that says, or equivalency thereof, like other aspects of the person's background that could be considered as equivalent to the standards that are referenced, that person's not going to be able to get the actual licensure necessary to even qualify to be interviewed for the position. So, but I'll verify that with DOA and then get back to Senator Matanane about what may need to happen.
All right, I look forward to seeing a copy of that job description recommendation that you made also, Dr. Mamie. All right, but thank you. And good luck to DOE on hiring more and really filling the need for our students.
We'll make sure.
And thank you again to all of you who are filling this need for our students and really helping them at this young ages.
Thank you, Senator Terlai. And thank you to the panel. Thank you, Nadine, Dr. Balhaja, Mr. Anderson, for your work on this bill. We're going to have to do some markups to address some of the concerns that have been raised by my colleagues. And so we'll schedule a meeting maybe next week to further discuss this. But thank you again for your input and everybody else that testified today for sharing their stories. Again, we're going to try and get this on to the May session agenda and get it up for a vote. The time is now 10:38. This public hearing by the Committee on Health and Veterans Affairs is now adjourned.